Hello, this is Crispin Flintoff from Not the Andrew Marr Show. Before this video starts, I'd just like to ask if you'd subscribe to this channel if you haven't already, because we will be covering the general election from a totally different perspective from what you get from the mainstream media. We'll be talking about the candidates who are taking on Labour and the Tories and pushing them all the way. So please subscribe and get updates. Right, look, I'm really pleased to be joined. He hasn't been on the show for a while now. Dr Bob Gill is returning because we've had some more NHS lies from West Streeting. How are you doing, Bob?
Very well, Crispin. Good to see you again.
Yeah, good to see you. And you know, the lies, we're getting used to them on Gaza. I mean, we're kind of getting them all the time. So they're all over the place. So now we can see the NHS is back in the lying frame. So I'm just going to play a clip of Wes Streeting getting very angry with anyone who criticises him and suggests that he might not be telling the truth. This is an interview, I'm afraid, with The Sun.
I mean, look, I've had loads of grief. I'll tell you for me what it's all about. I got an email the other day from a guy called Dave about his mum's care. And this is what he said. I won't read the whole email. It's a long email and a really moving WhatsApp exchange between Dave and his mum. He said, "No doubt you're being inundated with abuse, indignation, and all sorts of grief from those who have no idea what you're talking about. So I just wanted to say thank you. Thank you for representing my mum and those who like her. Hard-working folks with 18 plus months on the waiting list for a new knee, unable to effectively move around her own home, who is lucky enough to be benefiting from the NHS using," and he mentions a private provider, "to reduce her waiting time. It means so much to her and all the family as we can't afford to jump the queue. I'm in it for people like Dave. And frankly, making sure that Dave's mum can get timely access to care is more important than people's ideological hobby horse. And what I'd say to my critics online, including those people who regularly take to Twitter as keyboard warriors, you have to look people like Dave's mum in the eye and tell her that your left-wing principles are more important than her getting timely access to care. And my left-wing principles say that working-class people should not be left behind while middle and upper-class people can afford to jump the queue."
Now that clip, he says that Twitter warriors are keyboard warriors. I mean, you've been blocked on Twitter by him, and he's blocked Not the Andrew Marr Show as well. So I don't know where he's reading these Twitter warriors. What do you make of his sort of faux anger about he's trying to get things done? I mean, he's not even the health secretary. What's he on about?
Yeah, I wouldn't put it past him for actually soliciting the email in the first place. I'd like to know whether this Dave that he's received the email from is actually a Labour Party member and anything to do with the Ilford North constituency. He's using very manipulative language to make out he's the defender of the working class. He's talking absolute nonsense. Yes, I'm one of these Twitter warriors. I'd love to have the opportunity to go up against Wes Streeting in a debate. He calls us idealistic and other words to say that we're not in the real world. But the reality is that Wes Streeting's analysis is devoid of economics or logic, because what we are fighting for is a restoration to a common sense model that doesn't waste money on profit and administration and management and servicing PFI debt. Most of my patients are working class, but they are discriminated against. It's in fact the middle classes who are best able to navigate the NHS as it's crumbling around our ears. And the idea that, this private sector is benevolently coming to the rescue of the NHS is total nonsense. There isn't a duplicate workforce standing idly by in the private sector waiting to help the working class. The private sector is cherry picking the easy cases. They're given cases that guarantee profit. And if things go wrong, the complications are dealt with by the NHS. The negligence is paid for by the NHS. So the public purse is guaranteeing and underwriting profit for the private sector, which very often will be offshored or avoid tax. And in the end, instead of building capacity within the NHS, we are diverting money away. Wes Streeting, if the NHS was a patient and Wes Streeting was its doctor, he would be ignoring all the symptoms. He would ignore the fact that the patient's been poisoned for 40 years, and he would be prescribing a treatment that kills the patient.
Right. Yeah, I mean, and the thing about this that annoys me a lot is that Streeting and Starmer are trading on Nye Bevan's Labour Party being the founder of the NHS. Labour's got the branding of maintaining the NHS, fighting for the NHS. There's all this stuff about Blair saved the NHS, and we know that was a lot about PFI. But I think, I think it's possible to undermine the whole Starmer project with taking them on the NHS, because the other pledges they have are very woolly. They don't mean much at all. But if we see these are their 5 pledges, I mean, there's hardly any policies coming out of Labour, but get Britain building again is just nothing. It doesn't mean anything. Switch on Great British Energy. That's not nationalising anything. Get the NHS back on its feet is its 3rd pledge. It's like, this is the thing that we will be good at. We've got an answer to that the Tories can't solve. And I think if it's possible for us to bust that mythology that he's putting out there, then we could take down the whole structure of Starmer, because I think he's getting away with the media not actually challenging him at all. I'm just going to play what happens if you're a voter, you want to find out what is Labour's pledge on the NHS. This is what you get on the website. I'm sorry for anyone watching it. It's Streeting again.
A central mission of the next Labour government will be to build an NHS fit for the future, not just to arrest the crisis in the NHS we see today, but to make sure the NHS is fit for the next 75 years, with all of the opportunities and challenges it will bring. At the heart of our mission is the biggest expansion of NHS staff in history, so that we've got the staff we need to treat patients on time. A Labour government will mean not just a great national health service, but a neighbourhood health service in every community, with better access to see a GP, more new facilities like community mental health hubs and support available for young people in every school, making sure we've got the district nurses and health visitors we need, as well as social care, to treat people and care for them in the comfort and safety of their own home. The next Labour government will ensure that we harness the enormous breakthroughs we're seeing in life sciences and technology, with discoveries being made here in Britain. Partly so you can book an appointment with a GP as quickly as you can order a takeaway, but also so that we can provide the groundbreaking treatments available, and to make sure that not only do we diagnose faster and treat people faster, but to make sure we can actually predict and prevent illness.
What do you make of that flannel there?
Well, it might be convincing to somebody who hasn't got a clue what's happened to the NHS, but he makes very vague promises. There's no real detail there. He talks about, fixing the crisis, but he doesn't tell us what the crisis in the NHS is. It's a crisis that Labour helped create through PFI. It's a crisis of staff retention and staff wage suppression, which he never addresses. That would be probably the most useful thing that a Labour Party coming into government could be very clear on. We are going to settle the pay disputes, and we are going to stop the hemorrhage of doctors and nurses out of the NHS. But they're not saying that. They're not saying a word about it. They're not also saying a word about the legal policy changes that have already taken place, which fundamentally repurpose the NHS. And some of the language he's using, a neighbourhood service, well, what does that mean? It fits into the narrative and the policy objective of the broken NHS, no longer a national health service, but a series of 42 public-private partnerships. He doesn't challenge the creation of these for-profit public-private partnerships. And he talks about helping people in their own homes. Well, this is another policy objective of the Tory government, which is to maintain an inadequate bed capacity, and dump people at home who are going to be monitored in some virtual way, thereby handing a massive bung to the big tech companies, which in real terms will lead to elderly, vulnerable people dying or getting inadequate care in their own homes, but tech companies making a handsome amount of profit. And he's presenting this as some technological advance. So I can see multiple points in this vague narrative he paints, whereby the private sector will be invited in to fill their pockets.
And I mean, the other thing that people have been sort of fallen for is this thing about they'll put more money into the NHS. I mean, how would that resolve it? Even if they did, where does the money go? I mean, where does the money go? I mean, it doesn't go to healthcare, does it?
No, because there are so many parasitic leeches attached to the body of the NHS. They would love more money to be coming in, but we're not getting more bed capacity. We're not getting any more staff. We're not getting staff pay rises. But what we are getting is a growth in the management class and the admin class within the NHS. We have an expanding PFI liability, which isn't being addressed, and siphoning opportunities. So all NHS activity that is contracted out to generate a profit, and that means money diverted away from patients. Whenever the patients operate on somebody and they're getting, the private sector operates on somebody for the NHS, they are given a fee that includes a generous profit. Well, that's money out of the system. They're not doing it any cheaper or any better or in a cleverer way. They're just doing the simple cases for profit. And this isn't returning more money to the front line. So it's a deception. And it's a deception that is music to the ears to the corporations that are already infesting our NHS.
Supposing he gets elected, Labour get elected, and Wes Streeting is the health secretary, what would happen within a term? So they had 5 years. Do you think that the indications are that more people are signing up for private healthcare insurance? Is that what will happen? Is that going to be inevitable then?
Yeah, so there's no difference in policy objective from this Tory government to the next Labour administration. The policy is coming from the City of London, the big four accountancy firms, and the goal is to continue the vandalization of the NHS publicly provided system. People waiting longer and longer on waiting lists have a choice. Either they do without treatment, they pay out of pocket, or they take out private insurance. But what people won't realize is the insurance companies are only interested in making a profit too. So if you become expensively sick, they will price you out of cover. And if you're already expensively sick, they won't want to touch you, or your premium will be unaffordable. So this is not a solution, but it's very profitable. And, the system we're copying, the American system, spends twice as much money per capita of population and delivers much worse outcomes, with people dying at a younger age, a worse maternal mortality, worse infant mortality, shorter life expectancy. So, nothing that Wes Streeting says fills me with any hope that they're going to do anything meaningfully different. The rhetoric might be slightly gentler. They might get away with hoodwinking the public because of this reputation going back to Bevan. But let's not forget that Tony Blair's one of his major achievements for this sort of privatization agenda was to remove Clause 4 from the Labour Party constitution, which made it a neoliberal party, which made it a party, in bed with private capital and not looking after the interests of the public.
Right. So do you think it's possible for us to challenge Street? I mean, he's blocking you. He's blocking anyone who challenges him on social media. Do we need to take a more direct approach, direct action, so to speak, on this to get the word out? Because it's not being covered by the media, is it, at all? They're not they're showing pictures of Streeting and Starmer with their sleeves rolled up in the hospital and saying they're going to fix the NHS, and they don't really challenge them. What else? What do you think we can do? What are the health unions doing?
So the health unions aren't doing very much, I'm afraid. Some of the rhetoric's getting a bit better, particularly with this sort of doctor substitution agenda that has become more widely known recently. There is a independent candidate standing in Ilford North against Wes Streeting, which is, warms my heart that somebody is going to be calling out his track record and what Labour will do on the NHS. And I have supported that candidate, and I'm happy to support further. But, without independent media such as yourself, Crispin, this will not get out widely enough. So, your work is very important. But going on a channel run by the Sun newspaper should tell people a lot about the intentions of a Wes Streeting, Keir Starmer government. It's not to serve working class people, contrary to what they're claiming to do. It's to serve the likes of Rupert Murdoch, the billionaire class, and the American corporations that are, chomping at the bit to devour what's left of the NHS.
Yeah. Well, we'll keep interviewing you as long as you can take it. I mean, you've been doing this for such a long time, calling it out. It must be really frustrating for you to keep seeing him getting away with this stuff.
Well, yeah, well, he's only getting away with it because he will only do interviews with people he knows will give him an easy ride and like what he's saying. We have a totally fake setup between politicians and the mainstream media that they can say whatever they like. They won't be challenged. In fact, you've got the ludicrous situation where more and more MPs are moonlighting, working for media organizations like LBC and GB News. So, the separation between the media and the political class, that fourth estate supposedly holding them to account, is a complete joke. So, this is not good enough. It's certainly not core to what we believe is a democracy. We need an independent media, robust media that challenges government, challenges our politicians. That has died a long time ago.